Good morning, everybody. Welcome to TeleShadowing. We are live on YouTube. Please feel free to ask questions in the chat box as we go along and they'll be addressed. I'm honored to introduce our mentor for today, Dr. Khan. Dr. Mateen Khan is a lecturer in the Central Jersey Institute of Islamic Sciences and the Lantern Institute. He teaches Islamic sciences, including commentary of the Quran, Islamic jurisprudence, and the prophetic traditions. He is also a contributor at Muslim Med, which aims to provide Islamic guidance on contemporary issues related to healthcare in the United States. Dr. Khan is also an ER physician who did his residency in Christiana Care in Delaware. Right now, he is active in the Central Jersey and Philadelphia area. And now it is my honor to request Dr. Khan to begin today's session. Thank you.
Thank you, Muhammad Hamza. As introduced, my name is Mateen Khan. I am we'll get into who I am in a second, but it is an honor and thank you for the invitation for TeleShadowing. When I had not been aware of this sort of initiative, and after finding out about it, I'm actually very pleased with it. The ability to have people from such varied backgrounds all over the world to come and give their expertise, to give their experience is actually a very nice thing. And I sort of wish I had it when I was in medical school or preparing for medical school. So today, my goal is to sort of give you insight in what I do that is perhaps different than most other practitioners. I'll keep it informal. Not trying to bore you or not trying to get into a lot of detail with things. And as you'll realize very soon, my slides are sort of bare bone, not because there's not a lot of information to give, but mostly because I would like you to sort of listen to what I have to say and not read what's written on a slide. So before I get into everything, my background is emergency medicine, which I love and I enjoy, and we'll talk about how I got there.
I'm sorry to interrupt, but you need to start streaming one more time.
Meaning my screen?
Yeah.
Gotcha. Let's try this again. All right, we're good?
Yep, this works.
Okay, good. So as a quick introduction to my background, I'm an emergency medicine physician, but in addition to that, I've spent a significant amount of training and time on Islamic studies, particularly within bioethics within the Islamic field. So we'll talk about that and sort of where those two things come together in my world and what makes it different than perhaps most practitioners. So first, let's get into a little bit of background. I'm not used to talking about myself, so I had to actually think about what this would mean and what I would talk about. My parents, so I'm in the United States. My parents are immigrants from India back in the 70s, so early on. I was born in West Philadelphia, grew up around Philadelphia in the suburbs of Philadelphia. So anyone who's sort of aware of Philadelphia, it's an inner city location, West Philadelphia more so than other places. And then after that, the shift out to the suburbs that I actually grew up in is about Bensalem in Lower Bucks County outside of Philadelphia. So anyone aware of that, because I know there are some people who are around the Philly area. It at that time was a very suburban area, kind of your white picket fence. Everyone has green grass in front of their home and so on, but a very non-diverse area. So we grew up as sort of minorities in race and religion. But the benefit is that it gave me the opportunity to directly experience two cultures. And I know I'm not alone in this, just about every immigrant has this experience where I grew up in a piece of Western culture, going to school from the very beginning all the way till the end of high school, but at the same time, a very strong sort of Eastern culture, at least one aspect of it, which my parents brought from their home country and brought into our home as well. So besides that little piece of Eastern culture, I'd say my upbringing was more or less typical throughout high school for what an average sort of American would experience. At that time, my interest in medicine was nothing more than I want to be a doctor. I'm one of those guys, and perhaps there's many of you as well, that ever since I can remember, that's what I wanted to be. In kindergarten, when my teachers asked me, what do you want to be when you grow up? I said a doctor. What that really meant, I have no idea. In fact, I'm pretty sure back then I had no idea what that really truly meant. But as far as I can remember, that's what I wanted to be, even though there weren't any physicians in my family or in my friend circle. But it was something that appealed to me, at least the concept of it and the idea of it. And so that's what I went with. Now, so the three aspects of my sort of training, Bensalem, Pennsylvania is where I went to school, Temple University is what we'll talk about next. And then Christianic Care is the residency where I did emergency medicine. So after the suburban culture, the suburban, being raised in it, I went out to Philadelphia. Maybe I could say I went back to Philadelphia. And Temple University is an inner city campus, very large and well known throughout the United States. Why Temple? Well, Temple was kind enough to offer me a full paid scholarship. And as somebody who wanted to go to med school, that was a huge deal, to be able to go at least to undergrad for free and not have to worry about that debt or that expense. So even though I had applied to other Ivy League schools and gotten accepted, when Temple said free ride, I jumped at this chance and took them up on the offer. So besides the education at Temple, which I'm very grateful for and obviously worked out the way that I wanted it to work out, it gave me perhaps an education, something that is more important. And that is that it allowed me to become acquainted with people of different cultural backgrounds and different practicing backgrounds. And by that, I mean people from all across the United States, people from inner city and from suburbs, people from international areas as well that came in as foreign students. So I got a chance to become friends with Koreans, Malaysians, Indonesians, Africans, Middle Easterners, Europeans. I had a chance to interact with all of those people. So which gave me a lot of insight into different things, which I'll touch upon in a little bit. My major was biochemistry, and in hindsight, probably not the best major to take on if you're going to become a physician, but I enjoyed it. And I had a good time watching electrons move from one thing to another, different molecules form different compounds and compounds forming other compounds. And now, as I say it, I sound sort of a nerd, but it was something that I truly liked and I enjoyed it. But I would say, coming back to the idea of becoming a physician, that even in undergrad, I'm not quite sure what that meant. Meaning I knew what doctors did by that point. I knew the role, the job that they did, but what was it like to be a physician? I don't think my understanding of it was any more than what a layperson would imagine a physician to be. Meaning physicians help people get better. And it seemed like a noble endeavor. So I stuck with that idea. I made biochemistry my major. I made pre-med my secondary major, and my trajectory was still in that direction. But around this time in undergrad is when this binary started to form. And here on out, I'll start talking about sort of the Islamic ethics aspect of it. And those people who are Muslim, you may have some appreciation of this, or perhaps you may not if you come from a very heavy kind of cultural Islamic background. And if you're not Muslim, then I think you'll be able to understand, at least in your context, where this comes from and sort of the larger idea and framework that I'll be discussing. So this binary that I'm speaking about is, at least from the perspective of medicine in undergrad, I started doing that usual pre-med thing, some volunteering here and there, research in biochemistry, made sure the grades were solid, took care of all of that. From the perspective of Islam now, this is sort of where I started to hit my stride, where I started to meet people of different backgrounds and was a part of the Muslim Student Association, which at the time was a very large organization, which reached well across the campus and into the city as well. So the Muslim Student Association, or the MSA, had its roots all across Philadelphia. And people from all across Philadelphia would come to us. We would host events, not just for the campus, not just for Muslims on campus, but in the entire city at times. So again, it allowed me to sort of reach out to these other individuals, get acquainted with them, their needs, their worries, their responsibilities, things that they felt like they weren't getting, things like that they felt that they owed or were owed by other people. It also gave me exposure at that time to different influential Muslim movements. So those who are sort of keen on the Muslim American scene, you know about Zaytuna Institute with Hamza Yusuf, Zaid Shakir, Abdullah Ali. So these are individuals that back then were relatively not known. Zaytuna itself wasn't even formed yet. So I had the opportunity to sit with them, talk to them. I met people who were from a traditional Sunni background, people who were culturally Sunni, people who were Salafi, Shia, the Nation of Islam, people who represented academic Islam. Dr. Khalid Blankenship was one of the main directors of Islamic Studies on Temple campus, and Islamic Studies at Temple University was one of the best well-known Islamic Studies programs in academia across the world. Dr. Blankenship was a huge influence on me. He may not know it, but he definitely was guiding me sort of in that direction of what it meant to be an intellectual Muslim, or what it meant to encompass a religion in a way that wasn't just culturally lived, but one that was academically, intellectually understood and expounded upon. And then I met those Muslims who really didn't attribute anything to themselves other than just being Muslim. So the point being is that this is sort of where, from the binary perspective of medicine, I started moving in that direction more so and committed my life to it. And from the binary perspective of Islam and Islamic studies, I started to really get a feel for all of that. So I began to read a lot. And I still do. Started having conversations with people of different backgrounds, trying to understand their story. Where do they come from? Where is their understanding, or what is their understanding based on? So eventually, after doing all of that, I settled on traditional Sunni Islam. Why? And by that, I mean that Islam which is represented by the four main juristic schools of the Hanafis, Shafi'is, Malikis, and the Hanbalis. So for those who aren't Muslim or don't have the background, within Islam, there are four major schools that represent the juristic rulings aspect of the religion. And so this is what I refer to when I say traditional Islam. For me, this particular branch is the most authoritative and the most principled. And what principle allows you to do? It allows you to understand something logically, and it allows you to then use a logical approach to move past that, to deal with new issues. But this brought me sort of to the end of my undergraduate studies. I wasn't quite finished. In fact, I would say I didn't even really start. But I had to put that on hold because after that came medical school. Now, the thing about Temple Med is that sort of in the same way where when I was a high school student, Temple came to me and said, we'll give you a full paid scholarship. I said, thank you very much. I'll take you up on it. Near the end of my undergrad experience, actually not even the end, at the end of my third year, one of the directors of pre-medicine came to me and said, if you apply to Temple Med, early decision, consider yourself accepted. And so here I got another offer from Temple saying that if you want to come to Temple Med, put in your application, don't bother anywhere else, and consider yourself accepted. So I took them up on the offer as well. I like Temple, and I'm not making this an advertisement for Temple University, but you guys can tell that obviously I really enjoyed my time there. I had a lot of good experiences, and I found it to be very beneficial. So after having seen that in my undergraduate years, when Temple Medical School came to me, I said, absolutely, I'll take you up on the offer, which made my experience really easy. I didn't have to go through the process of applying, interviewing, worrying. And so when life hands you something very easy, you are grateful for it and you take it, especially when it fits in line with what you'd like to do. So I took him up on the offer, I got accepted, and I continued my education there in a system that I trusted and a system that I felt comfortable. But perhaps more importantly, in hindsight, what it did is it kept me in Philadelphia for another 4 years. And that another 4 years allowed me to grow more in the city of brotherly love, where I was able to reach out to other individuals, make really good friends, and sort of start working in the direction of working with people who were helping others in need, who legitimately cared about individuals, not just from the aspect of their physical needs, their medical needs, but also their spiritual needs and their emotional needs. To be able to understand people that come from different walks of life, who's been through drastically different experiences than that I've had, to understand why not everyone is able to do what I've been able to do, or other people from my background has been able to do, but respect them because of that. So I like my time at Temple. As far as med school goes, I divided up into 2 parts. The first part being the first 2 years, and the second part being the clinical years, the 3rd and 4th year. So the first 2 years, and I would encourage any of you guys who are in this process or looking forward to this process, is that you use those first 2 years to grow. And by that, I mean, don't just learn medicine, learn everything you need as far as the facts go to become a good physician or a good practitioner if you're going into another field. But also use that time to grow as an individual, because it may be the last time that you actually get before you're thrown into the world of medicine and clinical responsibilities. So the first 2 years, I had the opportunity to continue that. I spent a lot of time back on Temple undergrad campus. So Temple undergraduate and Temple medical schools are school is about 2 miles apart down Broad Street in Philadelphia. So you can be on one campus and not experience the other campus. I found Temple undergrad to be a much larger city within a city. And after having my experiences there and contacts there, I'd still spend a lot of time, especially the first 2 years there. And I continued to interact with different individuals there. Now, fast forward a little bit at the end of my third year, well, let's talk about so now I'm starting to understand what it means to be a doctor. I'm having experiences with other physicians who are teaching us at Temple Med, people who come by and guest lecture, other Muslim physicians on Temple Medical Campus that I run into. While I was there, I started an MSA on Temple Medical Campus, which allowed me to interact with those people, see their perspectives now for the first time, combining Islam and medicine together. And what I found was that it varied a lot. Some of them actually took the time to study a little bit of Islam, and so their understanding was deeper, better. And others were still sort of functioning off their cultural Islam and doing the best that they can from that perspective. So near the end of my third year, I'm sort of at a cross point. I have to now choose what specialty I'm going to do. What am I going to aim as far as my residency goes? Up until this time, I've only sort of thought of medicine as something that you do to help people. And I'll be quite honest, at this point, when I meet other medical students who have really gone into depth about what each field represents or have already decided what field they want to be, I was really lacking at that point. My thinking of medicine was still rather elementary. It's something that you do to help people. You have a clinic, you take care of anyone that needs to be taken care of. So now at the end of my third year, they're saying, listen, you need to choose a residency, you need to start applying, you need to make a decision. So now, what made me go towards emergency medicine? Number one, it's when I did my rotations in the first 3 years, in the third year, my first rotations, the sort of core rotations, I found that I enjoyed all of it. Internal medicine, I liked. Surgery, I liked. OB-GYN, I liked. Family med, I liked. All of it was interesting in some way or another. I can't say they're all the same, but there wasn't a field that I didn't like. Number two, in my mind, up until this point, what I thought a physician was, how I pictured a physician. I didn't picture him or her, I guess for me, a him, that as a cardiologist. I didn't picture him as a neurosurgeon. I pictured him as a person who took care of everyone. Old, young, male, female, didn't matter what your problem was. If you walked through the door, he took care of you. Whether you're in the office, whether you're in the public, it didn't matter. This is sort of, it may have been naive at the time, but this is what I saw as a physician. So when I started to think about that, what physician actually fits that mold? So there are a couple. There's family practitioners, there's internal internists, there's emergency physicians, obviously. And it's sort of what sealed the deal for me. And oftentimes we make fun of those medical students that have already chosen a field and they're completely gung-ho about it. Everything about them says orthopedic surgery, for example. They sleep it, they eat it, they breathe it. Oncology, this is all I think about. I read journals. Even as a teenager, I was reading journals, and so we sort of make fun of those individuals. But the fact is, I ran into one of those at the end of my third year, and he was an EMS medic beforehand. So he used to go out on ambulances. He used to go into scenes of trauma and things like that. And so he had come to the decision that emergency medicine was the field for him. So after leaving his EMS position, he went to medical school, and then he was gunning for an emergency medicine residency. I ran into this individual one day, one conversation. I don't know who he was, and I haven't kept in touch with him. But it goes to show you that there's certain things in life that can have a great impact on you that you only realize in hindsight. So this one individual, again, I have no idea who he is, didn't know him at the time, and I don't know him today. But we had this lengthy conversation about what we're going to do. And when I listened to him speak about emergency medicine, I realized that this is what I had in mind. To me, a physician, what I've been thinking about since kindergarten was an emergency physician. This is what they did. They took care of everyone. And I'm sort of a jack of all trades type of person. I can't really get myself to commit to one thing. I want to do everything. I like everything. I want to be able to know a little bit about everything. So that pushed me over the edge. It made me decide that emergency medicine is where I'm going to go. And so after that, I took 3 clinical rotations, and I'll tell you a little bit about them as well. Obviously, I was at Temple University, so I did a clinical rotation in Temple ER's level 1 trauma, an absolutely chaotic place where everything from gunshots to stabbings to, stubbing your toe, everything walks through that door. People who take care of themselves, people who absolutely don't do anything for themselves. The worst things that you can imagine will walk through that doors from and the most mundane. People can be everywhere. The place wasn't that big at the time, and it literally sat on Broad Street, so people could walk in from anything. And so it was a very chaotic environment, but it was one that I've never experienced before. It made me see sort of the inner workings of a level 1 trauma center, the inner workings of people who had to live on the edge and take care of people on the edge at times. The second rotation was Temple's pediatric emergency department, which at the time was right next to the main ER in a building next to that building. And that too was a much better environment than the trauma center, but was an environment where you took care of kids from all types of backgrounds. There were some really sick kids. There were kids who had chronic medical conditions, and then you had your runny nose as well. And so that gave me a different perspective. And then the third rotation was at Christiana Care in Delaware, which I'll talk more about next. I did a rotation out there because I wanted to experience an environment that was different in location, one that was outside of the city. And at the time, I was already looking at it as a potential place to go to residency. So I thought, you know what, let's go check it out. So that was a residency where, and I guess I'll talk about it when we get to it. Anyway, between these 3 locations, I had my exposure. You saw how I made the decision. I went in, I double checked, I got the exposure, loved it, and said, you know what, I'm going to be an ER physician. This is what I'm going to do. But I won't lie to you either. Not every rotation is great. Not every rotation was great. Some shifts were downright terrible, meaning it was a chaotic environment. It was difficult. And especially as a medical student, you often feel like you're just in the way. You have trauma surgeons running around. You have ER physicians running around. You've got really good nurses that are doing their job. They all know what they're doing. You're the guy in the room who has no idea what you're doing. If you know how to do chest compressions, consider yourself a hero. You at least had one thing that you could do. And so oftentimes in that situation, you would get lost. You would see what everyone else is doing, and you'd have to just sort of move back into a corner, especially when things got really hectic. Let them do their job, stand and watch. So not every shift was always enjoyable, but every shift you walked out feeling like you learned something and that you had a positive impact on people. And that still continues to be the case even today. Every shift I walk out feeling like this was something new that I haven't seen before, or this was a new fact that I didn't know before. And at least one individual, if not multiple, that I actually made a decision, an impact on their life today. They came in concerned, they came in worrying, and they left feeling better, or at least they left with an answer. So that was Temple Med. And afterwards, my first choice in residency was Christiana Care. Did my rotation there during medical school, like I said, made some contacts, talked to the people, talked to the residents, talked to the nurses, and said very clearly, this is where I want to be. I like it here. I like Delaware. I like the location. I like the hospital. You guys are doing some really good stuff. The residency is solid. I want to come here. And the match reciprocated, I guess. I ranked them number one. That's where I went. So let's go into residency. Christianity Care is a great place to learn. And don't think that I just praise like every single place. I can be critical, but Christianity Care was a great place to learn. Our attendings there, they cared about emergency medicine. They cared about their patients. They cared about their colleagues. They cared about their residents. So Christianity Care is where I learned to care about people in the perspective of medicine. It's not to say that other places didn't or that Temple didn't, but Christiana had a more homely feel to it. And that may be just because it wasn't as chaotic as Temple was. It's where I became confident in my skills as an emergency medicine physician, but also humble to know that you will make mistakes. And I have made mistakes, but to learn from them and never think that you're above them. It's also where I learned that medicine is more than just biology. It's more than just giving a medication. It's more than just finding a cure for people. It involves real ethical decisions. It involves every single person having to embark on a journey to know their own values first, so that they can then work with the values of other individuals or guide them in it if they haven't really figured it out yet. So Christianity Care allowed me to grow from the perspective of medicine, and being in residency, it really took up a lot of my time. I was already married at the time as well, one child by the end of the second year of my residency. So family life had started, and the responsibilities continued as an emergency medicine physician, but it allowed me to grow. There was one other experience that I had that's worth mentioning, and that is during my second year as a resident, I had the opportunity to do a clinical rotation in Saudi Arabia. And more specifically, it was done in Mecca during the time of the Hajj. So this is probably something I could talk about a lot, and I don't want to take up the entire time on this alone, but this was sort of a game-changing rotation for me, because I got a chance to work in Mustashfa Mina, which is the hospital in the center of Hajj during the days of Hajj. And this, fortunately for me, but unfortunately at the same time, was the last year that a major stampede had taken place during the Hajj, in which somewhere around 300 people were killed, obviously accidentally, but still a very traumatic experience. But being in the hospital in the middle of that gave me an amazing opportunity to take care of people who had come, leaving everything behind, leaving their homes, their families, their wealth, everything behind, to have experienced this rotation, to have experienced the Hajj experience. And for me to be in the middle of that, taking care of them, taking care of people who were breathing their last breath as they had come for Hajj or soon after finishing it, to meet these people who didn't speak a language that I had even heard of, let alone spoke myself, to see what kind of care they got, to see the worries, the contentment that they had, or the concern that they had. So I had that opportunity for about 3 weeks during that. So now let's keep moving to the last part of my training. So throughout medical school and residency, I put my interest in Islamic studies sort of on hold, because my training sort of demanded more of my time. But now, after finishing residency, I now found myself in a place where I'm about to jump in as an attending, but also came to the realization that this may be the last time that I will actually have in my life to study Islamic studies in a way that is comprehensive. So I moved to Buffalo, and then after that to Canada. And I joined one of the oldest Islamic seminaries in the United States full-time. And full-time means this is a very rigorous curriculum. It's 6 years of 10 hours a day for 6 days a week. It's a lot. It's time demanding, and it's intellectually, mentally demanding. So I had to cut back emergency medicine to part-time. I worked 2 days a week, and I went to school 6 days a week. Obviously, the math doesn't add up, but you sacrifice sleep, you sacrifice meals to get what you want. And you marry somebody who's very understanding. So I, by the grace of Allah, had all of that come together, and I spent the next 6 years studying Islamic studies full-time. So this is a wide-ranging curriculum that includes language studies, Arabic and Urdu, not to mention English that had already had. It requires study of the original source material, the Quran and the Hadith. It requires studying an expansive amount of texts based upon those material. It involves learning sort of overarching ideals of metaphysics and morality and aspects that deal with daily life, daily decision making. The Islamic sciences also has a very robust view on medicine, on medical ethics, on medications, the role of patients and practitioners. So all of that is something that I had to engage in. So as you can understand, that by the time I finished my studies here, I'm now about 35 years old. So I've spent 35 years, I guess if we don't count up until kindergarten, 30 years in study and learning. And now at this point is when I finished, graduated, and now I can sort of bring this binary together. An expertise in medicine, specifically emergency medicine, and now an expertise in Islamic science as well. And this is when I start stepping into the area of Islamic bioethics. So there's a lot to talk about here. And so I'll give you a general framework. And you can ask me questions at the end more about it, but just so we sort of understand, what do I mean by having Islamic bioethics? I don't mean the idea that somebody is born Muslim or identifies as being Muslim, and then now based upon their sort of cultural or personal understanding of the religion, they try to understand medicine through that. No, what I mean is that Islam has a specific epistemology that its scholars have developed. And that epistemology ties in with its metaphysics, which ties in with science. And so when you put all of that together, you get a seamless understanding of reality that incorporates the metaphysics and the natural, meaning the sciences, in a way that's seamless, it's complementary, and there's no dichotomy in the mind of the individual. So its philosophy differs from naturalism, which is the dominant philosophy of science. What it means is that we don't just look at biology, for example, in medicine, but we look at things bigger than that. We look at biology, but we look at things beyond that as well. We ask bigger questions to create a framework that we can work within. Work the medicine into it, work our values into it, work an understanding of metaphysical reality versus the reality that we see and test right before us. So although this type of knowledge is not inaccessible to the layperson, we can all learn it, but it does require a significant time to learn it, understand it, and then incorporate it into medicine, particular medicine today, which is based on a Western philosophy of naturalism. The Islamic idea of it has been lost, I'd say, most on just about every practitioner that trains within the Western realm. In the Eastern realm, I'd say the same thing as well, because even that is very much based upon sort of a Western approach to medicine. So then within that larger framework is an ethical framework. And that means that we create a path which tells us what is fundamentally good and what is fundamentally not good. Many past Islamic scholars were practitioners. They were physicians themselves. Some were nurses, some were doctors. So, and this was natural, considering the fact that the Prophet Muhammad, sallallahu alaihi wasallam, that he had established this idea that a cure exists for every single ailment. And not only that, that we should try to find what that cure is. We should try to seek it. If you're the layperson, find somebody that knows it. And if you're the expert, then it's your job to research, to find out what that cure is, to go through books, to go through remedies, to do original research. That all of this is sort of indicated by the Prophet himself. Some of our scholars, like Imam Shafi'i, who's one of the great scholars, one of the four founders, if you want to call him that, of the juristic schools, he had said that after the Islamic sciences, there's no more noble field than medicine. So we see that there is a push within Islam itself, within the Islamic sciences, that a person should go into this field and master it, but do it from within the perspective of that Islamic framework. What's the benefit of doing that? And the benefit obviously are for Muslim practitioners, but even non-Muslim practitioners, I think you can appreciate this idea that practitioners will face moral dilemmas. All of us do. All of us will. They can range from things that are in utero, like birth defects, to end of life care and everything in between. They can be personal to yourself, or they can be personal to the patient that you're taking care of. So there is this field where medicine and morality intersect. There's no avoiding it. You're not going to learn this in biology. You're not going to learn this within the sciences. This is something that has to be developed outside of it, or at least in conjunction with it. So we require a strong ethical framework to do our job in a way that is complete, in a way that's whole, because human beings are not just biology. Human beings are sort of different than the rest of the animal kingdom. We have morality. We have a concept of this is good and this is not good. We have an idea, a framework of we should do this and we should not do that. So having a strong ethical framework also fulfills personal needs for practitioners. So for example, it lessens the emotional burden that you'll have to deal with when you make those moral decisions. It'll give you some sort of guidance to work within, so that you're not just making up things on the fly, that you don't have one idea today only to realize a month later or a year later that you were wrong, that that decision that you had made at the time was not the best decision for the person. It also gives you a sense of satisfaction that you've conducted your care in an ethically good way. It also reduces, and studies show this, that it reduces burnout. It reduces the perception that there are incongruencies within the system that practitioners work in, that it reduces this idea that there is the hospital and the system and then you in between somehow. It allows you to sort of seamlessly work within that in a way that you know you're doing the right thing. So for Muslims specifically, this is also important because Muslims, lay people, tend to seek out Muslim practitioners, hoping that those practitioners understand where they're coming from, that they understand the Islamic framework that they as patients would like to work and live within. And they're hoping that that Muslim practitioner can guide them medically in a way that is Islamically ethical. So then the burden falls on the practitioner, on the provider, that you give this patient direction in complex situations, that you coordinate a team approach that involves what's best for them medically and biologically, but also what they hope for best in an Islamic context, bringing together legal experts and people of knowledge of that field to help join that team. And then what an ethical framework, and more specifically an Islamic ethical framework, does is that it places that practitioner in a larger metaphysical framework in which they essentially can see themselves acting as the hand of God, or acting as the sabab, the cause that God provides in this world, so that you can ease people's hardships, so that you can give them further meaning in their role as a patient, and you yourself can take further meaning in your role as well. And as I mentioned, patients and their families often base their moral foundations within the religion that they practice, be it Islam, be it something else. Or if they don't have a religion, they still have something that acts as a moral framework, or in other words, it acts as a religion for them. Even those who refuse or deny a religion entirely still have or are in need of that framework. So this framework will guide them in their decision making. And at times, they will go to significant discomfort, putting themselves or their families in difficulty so that they can do what they think is right. And oftentimes, if they've received wrong guidance, or they're basing it upon something that is cultural rather than religious, or what they hope to be religious, then they may be doing things that are not right, even according to the framework that they're trying to follow. So all of that requires that we sort of open our mind. Sometimes we incorporate that knowledge ourselves, or we go and we find experts who can help us better take care of patients who adhere to those particular fields or those particular backgrounds. And so the way I see Islamic bioethics, or any religious bioethics for that matter, is that it's like a consult. So a patient or the representative will come and they will ask you, they'll present a scenario to you and say, what does my religion want from me in this particular scenario? What does it consider good? What does it consider best for me? So they're seeking a consult, an opinion from you. They don't have to follow it. Like any consult, you can say, thank you for your consult, but I'm not going to follow it. In the same way, when people come and they ask a question, we present them an answer. They can take it or they can leave it. They can go find another expert, or they can follow their own ideas, and that's perfectly fine as well. So now that we understand that point, why don't we get into a couple case examples so we understand? And these are real questions that people have asked me over the years. In fact, I would say over the past few months, because these are sort of questions that are fresh in my mind. So the first example, we'll start off with an end-of-life care example. And this is something that just happened to me last week. A person says, my sister. In fact, why don't we leave the quote? What essentially happened is that I had a patient in the emergency department. She's 80 years old. She's from an Egyptian background. She herself was an internist. So she knew medicine really well. In fact, according to her family and herself, she was one of the top physicians in Egypt at her heyday, I guess, when she was in her prime. But at this point, she's 80 years old. She's in New Jersey. She's bedbound due to a bunch of chronic medical conditions. And she's in a nursing home because of them. The family simply cannot take care of her with all of the medical issues that she has. So she came into the emergency department. In fact, the family had called the nursing home and said, we think there's a problem with her. Please send her to the emergency department. So, and the patient herself didn't want to go. But based upon her family's wishes, she agreed. She came to the emergency department. During that conversation, she said to me, please just send me back to the nursing home. I don't want any medications. I'm an internist. I understand my condition, and I don't really need anything. I don't want any medications. In fact, I'd like to stop medications entirely. Please make me hospice and send me back to the nursing home. Now the family calls me and says, point blank, she will tell you that she wants to be hospice, but it's against our religion for us to stop medical care. Now, this family doesn't know that I have an expertise in Islamic bioethics, and they are Muslim background as well. She's from Egypt, and the family as well. This is late at night. I'm doing an overnight shift, so it's not really the place to get into this consult, and nor are they consulting me. So we really didn't go down that route. But the situation that presented it to us is that, number one, she'd like to refuse care. Is she, from an Islamic bioethical perspective, can she refuse care? Can she say, I'd like to not have any more medication, that I'd like to be hospice? And if she can, are there any circumstances to that? Meaning, can a healthy individual who has no medical problems simply say, I don't want any medical treatment anymore? Can they do that Islamically? Let's take it a step forward. Can a person request euthanasia? Can they say, you know what, a passive euthanasia, I know not taking medication will kill me. That's fine. If I die, I'm okay with that. Or even an active euthanasia, that I've got all of these medical conditions, I'm bedbound, I have no quality of life. I'd like to take something to terminate my life. Can I do that? And then there's a question. This is a woman from a nursing home. And in fact, the family had sent her in claiming that she wasn't acting herself. So does this patient even have capacity to refuse medical condition? Is she in a mental state where she can even do that? How do we make that decision of capacity? What does Islamic bioethics say about that? So all of these are real questions that need addressing. And so just very briefly, can she refuse care? From an Islamic perspective, you can refuse care that is not 100% guaranteed to work. And really in medicine, or we can say near 100%. In medicine, very rarely will we come across situations where we can tell the patient, this will cure you 100%. So short of that, it's recommended that a person get medical treatment. We consider it to be a sunnah, meaning a practice advised to us by the Prophet Muhammad sallallahu alaihi wasallam, but we don't consider it to be necessary, at least by the four major schools. What about euthanasia? Well, passive euthanasia that involves refusing medications, knowing that you may die because of it, falls under that first category of refusing a medication that you know or that you don't know with certainty is going to work. And so a person can do that. You don't have to be treated for everything, particularly when there isn't a guarantee of it. Active euthanasia, that's not allowed. And the reason being is that Muslims consider life as a gift given to them. It's a trust, it's an amana that you are required to take care of. It's not yours to decide when you'd like to end it. So suicide is not permissible for that reason. Euthanasia, active euthanasia, falls into that same category. And then the idea of capacity is a more involved discussion, which we can leave for another discussion. The second case is a beginning of life care. And this happened to me a few months ago. A family called and they said that our unborn child has a condition that is not compatible with life. He will either die in utero or he'll die soon after birth. She is 22 weeks pregnant. The doctors are advising her to have an abortion. So Islamically, up until 4 months, there is some leeway to having an abortion based upon a particular need. It's not willy-nilly, however you feel like, but there is some greater laxity in that time frame. But after that, it becomes much more stringent, and we have to essentially prove certain conditions for that to be considered as morally okay to do. So what this family is saying is that we've got a child, a fetus. We know from expert opinion of physicians that this child will not make it to delivery, or if he does, he doesn't have the capability of living long after that, and we cannot correct his condition either after birth. So he will die. The doctors are saying, from their perspective, they don't see a point in going through with this pregnancy. They see it as a burden on the mother. They see it as something that will be fruitless or useless to undergo. So now the mother and the father of this fetus are contacting me to say, what does Islam advise us in this particular situation? Should we have an abortion as the doctors are telling us to or advising us to? Or should we continue with it and let nature take its course? Let Allah, meaning let God, do what he wills in the situation. And if the child dies in utero, so be it. If the child dies afterwards, so be it. And so these are important discussions to be had. And there is guidance on it as well from an Islamic perspective. And so it also brings up larger questions. In what circumstances is an abortion permitted? In what time period? Very early on, right after conception, before 4 months are done, afterwards, up until delivery? What is it that we're permitted to do? What is considered moral within the religion to do? Are there particular conditions of the fetus that are treated differently? And what conditions are those? So let's talk about another case here. This is during COVID, and there's a lot of Islamic bioethical situation that arose during COVID. One of those was with the vaccines. And here, I just want to give you somewhat of an insight as to what this involves. So we received a question asking us about the viral vector vaccines. And this specifically referred to the Oxford AstraZeneca, which was available in the UK and Europe, and the Johnson & Johnson vaccine, which was what we found and what we got in the United States. So there were a bunch of issues when you start looking at this actual vaccine that had to be dealt with. What do we do with these situations? So number one, the vaccine itself uses fetal bovine serum. So what is fetal bovine serum? Essentially what it is that when a cow is sent for processing, industrial processing, it's eviscerated. Everything from the inside is taken out at the time of its slaughtering. The reproductive organs, the reproductive tract of the animal is taken out as well, of the calf. And so in its uterus, if they find a fetus, what they'll do with that fetus is they'll clean it, they'll puncture into its heart through the rib cage, and they'll drain what they can drain from it, meaning the blood. And then that particular blood is separated out from its serum, and that serum is then processed. And that serum is where we get fetal bovine serum. So obviously there's some issues involved here. I think even from a Muslim perspective, as well as a non-Muslim perspective, that there's some ethical questions to ask about ripping a fetus out of a cow and then draining its blood and then using that as a media to grow cells and then to get viruses grown in that as well. There's also the issue of the HEK293 cells. These are human embryonic kidney cells. So essentially, decades ago, these cells were taken from an embryo, a human embryo. And then since then, they've been cultured and grown and made to grow indefinitely, or made to reproduce or cycle indefinitely. And those cells are used now to grow human viruses and then harvested afterwards. So what's the ruling on using human cells in this manner? Is it permissible to use human cells? So Islamic bioethics says that no, it's not permissible. That human beings have a special stature to them that has been given to them by God. In the Quran, Allah says that indeed we have honored human beings. We have honored the children of Adam. And so the ruling here would be that the specific use of these type of cells is not permitted unless there be a really strong need that would justify it. So there is that exception that allows it when the need is there. And then there's also the issue of ethanol, alcohol, which is in the vaccine itself. Is this something that people can inject into themselves? So these questions needed to be overcome. Another one that also has to deal with vaccines that we deal with every year is the influenza vaccine. So there are 9 different influenza vaccines that are out on the market in the United States. Some of those have some issues with them that make it difficult for Muslims to use. So for example, some of them are grown in an MDCK cell line, which is basically kidney cells taken from a Cocker Spaniel, so from a dog. So can we use an ingredient that comes from an animal, and more specifically a canine? And Islamically, that's problematic. Some of them are grown in insect cell lines, and using the products of an insect, is that permissible? And again, Islamically, that's problematic. Some of them use porcine gelatin that comes from pigs. Islamically, that too is problematic. So one by one, we had to go through all of the different vaccines that are available to find of the 9, which one are acceptable from an Islamic bioethical perspective, meaning it contains no ingredients that will be impermissible for us to either use or to inject into ourselves. Thankfully, that left 6 of them that were okay, and we publish that every year on our website, Muslim Med, for the general public, or general Muslim public, so that they're aware of what is okay for them to use, and that only left 3 of them which are not. So, thankfully that worked out well. Now, I guess I could stop here. In the interest of time, there is a couple of advice that I'd like to give you guys if I were in your shoes where you are right now. The Prophet Muhammad, he said, ad-dinun nasiha, that our religion is advice. It's giving good counsel to people. And so we take this very seriously. So a couple thoughts that sort of came to mind that I'd like to mention to you guys is that the landscape of medicine has really changed even since I've come into it. Medicine has become much more corporate, and I'm sure you guys have all heard this, and I don't mean to complain about it, but it's become much more corporate. And along those lines, financial restraints are real, and financial constraints on the practitioner have come into play that were not there before. So we're asked to make decisions sometimes that are not in the interest of a patient. They may instead be in the interest of a corporation, a hospital, your own practice, or even your own self, your wallet, your position, your standing. We're influenced by marketing. We're influenced by patient expectations, whether they be reasonable or not. And all of these are real factors that we have to deal with. But as we all know, our primary concern, our primary interest has to lie in the patient before us. So what you'll find is that even the most well-intentioned practitioner, and I think perhaps some of you who have done rotations, who have done shadowing, may have seen this because it happens so commonly, that we see practitioners prescribing, acting, testing, practicing in a way that we may say is more in the interest of themselves, their practice, or the corporation, rather than the patient. They're trying to kind of balance the two. So you'll find that the even most well-intentioned practitioner will make excuses for themselves to do what may be against the interest of the patient or the community that they're serving. And you'll hear excuses like, well, the government wants me to do it, or the patient wants me to do it. Even though it's not in the interest of the patient, they are asking me to do it. Or the administrators will come after me if I don't do X, Y, and Z. Or even that I need this job for my family. My kids are in college. I've got bills to pay. I need to go on vacation, and so on. And so they will find ways to give themselves an excuse to not necessarily do what's in the best interest of patients. And so it brings me back to my original point, that it takes a really strong moral framework to stand up for what is right in the face of this kind of pressure, which can sometimes be overwhelming and constant, consistent, putting you and your own personal interest at stake. But the fact is that medicine is based on trust, and lacking that based on desperation. And I think during the time of COVID, this really became clear, that the trust in medicine was undermined for a lot of people during this time. And so you will find people that only seek medical attention out of desperation. They don't trust us. They don't trust the system. And sometimes that's for good reason. But they come to you anyway because they have nowhere else to go. So people place their trust in you to do what is in their best interest, even though they may be skeptical of you. But the fact is they are there for that reason. So for practitioners, if you have a framework that's based in religion or based in something else, and more specifically for Muslim practitioners, because I know there's a lot that are listening, this trust is also a divine mandate from God himself. So you've got the patient expectation in you. You've got what it means to be a medical practitioner, to take care of the patient first. And then you've got a divine mandate as well that says that there are diseases and there are cures, and it's your responsibility to be that source of a cure, to be the hand of God that serves that cure, or at least makes the patient feel better for what is destined for them. But, and this is a big, strong but, it's simply not good enough to assume that you understand that mandate because you were born or raised as a Muslim, or because you grew up in a country that's Muslim. It's no different than a layperson assuming that they understand medicine because of what they picked up from their culture, or because of what they picked up from culture, movies, media, and so on. That you need to study it, you need to learn it, you need to engage with people that have actually studied it as a field so that you can learn it and know where your boundaries are. In the same way, if you're an internist, you know how much cardiology you know, and then you consult after that. As an emergency physician, I do this in just about every field. I have a little bit of knowledge in every single aspect of medicine. That's what it means to be an emergency physician. But I know those boundaries. I know the boundaries of my knowledge. I know when I've come to it that I need to seek a consult from an expert. This is no different. That when you're dealing with Muslim patients, and I say this on behalf of them, that when you're dealing with them, don't assume that you know what is correct simply because you grew up with that idea, but rather learn about it, know where the boundaries of your knowledge is, and then seek that consult from people that have an expertise. And it doesn't have to be somebody who has a dual expertise like myself. It can be somebody who has an expertise in Islamic law, in Islamic jurisprudence, and seek out their consult. You be the medical part of it, they'll be the Islamic bioethics part of it. And then together you can come up with a conclusion that serves that patient's best interest. And then finally, as an aside, I'll mention that don't let medicine define you. And I say this as a person to another person. There's this interesting concept for anyone who's seen the Matrix movies, that this idea of a residual image. And that residual image is what a person sees themselves in their mind's eye. If your residual image is a physician or a practitioner and nothing else, then I would encourage you to change that. That don't let medicine be who you are. You're bigger than that. Your personality, your humanness is greater than that one particular trait. Rather, see yourself as an individual first. Know what you consider to be good, what you consider to be right, what you consider to be the path that you'd like to take in this world, what you'd like to see from your families, friends, community. What are the ideals that people should be striving towards? Understand all of that. And then you can understand medicine better after that. All right. So Muhammad Hamza, if there's any questions, I'm free.
Yep. Thank you for your mentorship and teaching, Dr. Han. I'll begin the Q&A session right now. To start off the session, here's the first question. How did you integrate your passion for your religion and your medical school application, given you also had your pre-medical experiences covered?
So my medical school application wasn't very heavy on this stuff. As I mentioned, this sort of training came afterwards. I had an interest in it, but I wasn't really combining the two together just yet up until sort of the end of my residency period. So up until that point, I was still, I'd say, more or less a typical med student. My med school essay was based upon an idea that I had at the time of going into an MD PhD program. So I spoke about the different aspects of that. Islam was there, but incorporation of it into the medical field was not. And so that's one of the things I hope to sort of educate other people to start thinking about that early rather than having to grapple with it later in life.
Okay, thank you very much. As you recommended growing outside of medicine during the first 2 years, how did you personally grow in the first years of undergrad that led you to your interest in pursuing Islamic knowledge?
It was more or less a continuation of what I had in undergrad. So in undergrad, I had the opportunity to reach out to different leaders, different scholars, and different lay people. And so the first 2 years of medical school, I would say I actually had probably a bit more time in those first 2 years than I had in undergraduate. So it allowed me to get more heavily involved in work throughout the city that dealt with Muslims, that dealt with humanitarian issues with Muslims, through the MSA, through other organizations, and then also within the suburbs as well, coming back home. So I had the opportunity to use those first 2 years to extend my undergraduate experience to, rather than just a 4-year experience, to a 6-year experience.
Looking back, what was your interaction with the pre-medicine director at Temple that helped you get accepted to early decision at Temple Med?
Trying to find out the secret. So I would say there was no direct interaction. I mean, I knew him, he knew me. But what I think, again, coming back to the idea of me being sort of a nerd when it came to biochemistry, is that in the building in which his office was located, there would always be this one empty room. And that room had chalkboards on all 4 of its walls, in fact. So the way I studied was I would just sort of commandeer that room for the day. I'd go in, put my stuff down, and by the end of the day, you'd have 4 walls full of biochemical equations going across. That's how I learned by visual. I learned by looking. And so to write it out is the way I learned. And he'd see me coming and going. And it's not it's not that I did this on purpose. It just sort of turned out that way, that he over time realized that will come midterms and come finals, Mateen Khan would be in this room holed up for the whole day. And so he saw me in action, and being somebody who was very sort of involved with the pre-med students, he knew my grades, he knew what I was capable of, he saw dedication, and I'm assuming that's what led him to speak to the admissions committee about me.
Thank you very much. These next few questions are relating to your time in Islamic studies. So what is the hardest part of studying in Darul Uloom for full-time and also working?
Time. In one word, it's just time. A proper Islamic studies curriculum is draining. And I'd say intellectually, it's more difficult than medical school. You are memorizing a huge amount of information in a language which is foreign to you at first. You are attempting to understand concepts that are very analytical at times and very abstract at times, in a way that a science background, in some ways, in an analytical perspective, it does prepare you, but in a more abstract way, it does not. It's more sort of a liberal arts type thinking in that perspective. I don't know if that answers the question or not.
Yeah, that does help. Because this question is coming from me, and there might be other students here who are either watching on YouTube or on Zoom or later on when the stream goes up that are interested in doing Islamic studies after medical school. So is there any advantage or disadvantage in enrolling in Darul Uloom part-time instead of full-time?
Part-time is not really a structured curriculum to do. So Darul Uloom, at least where I went, was a full-time curriculum. I started off for 1 year doing it part-time, but realized that it's just not sustainable. You either jump into it completely or you don't. There are part-time curriculums available. For example, I teach at an institution, CJIS, where we do have a part-time curriculum. Realistically, it takes, what I did was 6 years full-time, 6 days a week. To do that part-time, we're talking about 12 years or so. So it's doable, but realistically, it's something that's probably outside the reach of most people. What I would encourage people to do is to join a part-time program so that you learn your basics. And by learning your basics, you can understand the outlook and you can form those connections with teachers and scholarship that will then serve you as your contact points for more advanced topics or consults, as I mentioned earlier.
All right, thank you. Here's a question that I've always had for a really long time. So how do we approach issues in healthcare that may be opposed to Islamic ruling? So for example, let's say you're the physician and a patient asks you to perform patient-assisted suicide. How should a Muslim physician deal with this issue? Because obviously you can't take part in it, but yet the patient is asking you to do it.
Yeah, so we all have to live within our frameworks, right? So the patient has their framework, which they're trying to live within with their morality, and they're seeking our help with that aspect that pertains to our field of expertise so that they can fulfill their moral imperative. So where the two align, then certainly I would say that we have a directive to help them, to assist them, to make their job, to make their life easy. But where we differ, then there needs to be some common understanding that the same way that you're trying to fulfill your ethical framework, your morality, I am too. And I shouldn't have to compromise on mine no more than I would expect you to compromise on yours. So where those two come together and there is a direct conflict, then I think it behooves everyone involved to sort of sit down and discuss it, to say that this is what you believe. I understand where you're coming from. I understand what you believe, what is moral and right to you, but also understand where I'm coming from and what I consider to be moral and right. And then between the two, I think, just about every time sort of work out something. And if you bring other people into the picture, so someone else, another practitioner that shares their moral framework, then perhaps you can connect those two people, or between all of you, you can come to a solution that works for everybody. I don't feel that anyone should be forced to do something that they consider to be wrong because someone else considers it to be right. At least not within the realm of medicine, for sure.
Thank you. How would you personally define quality of life when determining whether it's worth saving a patient?
How would I define quality of life in terms of a patient? This is going to be a personal decision at the end of the day. And by personal, I don't mean me, I mean the patient. There are individuals that I've met from nursing homes that are bedbound with their mentality completely intact. They're cheerful, they're happy, they've accepted their situation, they're okay with it. Then there's other people who are absolutely miserable. This is hell on earth for them, and they consider themselves to have no quality of life. Although from the outside, biologically, the two are the same, the issues that they're dealing with are very much different. So when we speak about quality of life, really what we mean is, what does a patient perceive as their quality of life? Now, what can be done about that? The question of euthanasia afterwards, that's going to be a moral question. That's separate.
Thank you. And for our final question, between being a scholar and a lecturer and a doctor altogether, how do you manage your work-life balance?
Not very well. I'll be honest, not very well. one of the problems with being a jack of all trades. So emergency medicine is a jack of all trades, and my realm within the Islamic sciences is also that as well. Although Islamic bioethics is something I deal with mostly because there's very few people to deal with it. I also still maintain a broad range of teaching that I do within teaching and research that I do within the Islamic studies realm, including aqidah, belief, fiqh, and fatawa, answering questions, and then Islamic bioethics as well, and then lecturing and all of this stuff. So there's no secret. It's the best that you can do is make sure that you identify what is important to you, that you make time for all of those things in some way or another. At times, the balance will shift to one thing more than the other, but you need to make sure that the balance readjusts itself later on. There's no secret here. It's a struggle. I at this point I've come to accept that it will be a struggle the rest of my life, but it's something that you do your best, and you hope that in the end everything turns out well, and that you fulfill the rights that are due to everyone. Hamza, there are a couple of questions in the chat. Do you want me to answer those?
Sure. I didn't see any of them, but sure.
One says, what if the mother was at risk as well? No, that's a different situation. So the scenario in case number 2 that I presented to you was simply about the child, the fetus itself. So that particular question is one thing, but now when we bring a threat to mom's life into it, that sort of alters the picture, and we'll have to ask the question of what kind of threat are we speaking about? Is it just a potential threat that most likely will not actualize, or we still have time to see where it will develop? Then we'll base our answer on that. If it's an actualized threat, meaning one that is inevitable or we consider to be almost certain to happen, then that will be a different consideration. So from a general answer, a general perspective, Islamic bioethics will give preference to the actualized life, which is the mother, over the potential life, which is the fetus in this particular situation. When do you choose to consult with hospital ethics committee? So when people ask me a question, they are asking me a question within the Islamic bioethics realm. So they are asking me, what is the position of Islam on this particular question? Now, hospital ethics committees, I've yet to see one that is able to answer this question. Rather, they will attempt to answer that question from the paradigm of modern Western medicine. And that's what's expected. That is their job. So if someone would like a consult from that paradigm, then we can consult the hospital ethics committee. But if a Muslim family is asking me from the paradigm of Islamic bioethics, then I really don't have a need for the hospital ethics committee at that point. And that's it.
Sorry about that. There's some people yelling in the hallways. All right. Are there any other questions that are here? All right. Thank you, Dr. Han. These are all the questions we have for today, and we really appreciate you taking the time out of your day to mentor us. I'd like for everyone to please give a warm thank you to Dr. Han in the chat box for this incredibly informative session.
No, I appreciate it, Hamza. It was very interesting. Made me think about some things I haven't really had to present in an informal way in this type of setting. I wish you guys well. I wish you guys luck. And for those who have an interest in Islamic bioethics, if you'd like to, you can probably reach out to Hamza. If you'd like my contact information, some further resources, discussion on the issue, feel free, inshallah, we can talk about it. This is something that I hope to spread to a lot of, if not every Muslim practitioner, to become aware of it at the very least, and then to incorporate it into their own practice and daily lives better.
Right. If anybody wants Dr. Han's contact information, my email is in the chat right now. You can email me for that. So again, I'd like to say thank you very much, and we really appreciate you taking your time out of the day. So now we're going to conduct our closing session with our quiz and our future dates. So the link to the quiz for this session is now live. You will need a 70% or higher to pass and receive a certification. So now on to our next session dates. These dates will also be posted throughout our social media outlets, so be sure to follow us at TeleShadowing. Our next session will be Saturday, October 29th at 12:30 p.m. Eastern Standard Time with our physician mentoring us in sports medicine and policy. Thank you so much for everyone for attending today's session. We hope to see you in upcoming sessions. This concludes this week's shadowing session. Thank you.